Good morning, and welcome to this special information session on the three new topics that have been added to the 2024 work program for the health cluster of Horizon Europe. My name is Stefan Hogan. I work at the Health and Digital Executive Agency, HDEA, where I head a team that implements the calls and monitors the projects for the health cluster and the mission on cancer. With me is Henriette Van Eyl, the head of unit for health and societal transitions at the European Commission's Director General for Innovation, Research and Innovation, who in a few minutes will tell us about the rationale behind the addition of these topics to the 2024 work program. Later, I will introduce the other colleagues from the European Commission who will present each of the three topics and answer your questions. But first, please allow me to briefly explain how the Commission and the agency work together. In short, the European Commission defines policy, including drafting the work programs, preparing these in agreement with the member states, while the executive agencies, such as HDEA, are responsible for implementing various EU programs, including Horizon Europe. In practice, HDEA publishes the calls for proposals, organizes the evaluations, prepares the grant agreements for the successful proposals, and then monitors the projects over their lifetime. We do our best to ensure that the projects can run optimally and that we make good use of taxpayers' money. HDEA colleagues are also responsible for providing feedback to the European Commission to inform future policy making. For your information, right now, we are managing the evaluation of 270 proposals submitted to the 14 earlier topics of the initial version of the work program 2024. These evaluations run until 19th of June, and the results should be announced on 19th of July. For the three additional topics, the deadline for submission is 26th of November 2024 at 5 p.m. Central European time, in other words, Brussels time. The results should be available around mid-February. But now, before I hand over to Henriette, I have a few suggestions to those considering to apply for these calls or any health cluster calls. I would like to remind you or inform you that you need to have a participant's identification code, a PIC, for your organization. Now, your organization may already have this. You can check this with the system. You will find a 2-minute video explaining this on the page for this event. I would also like to encourage you to get in touch with your national contact points, the NCPs. Their role is to help you apply, and in many cases, also to try and help you find partners. The NCPs have considerable experience, and they're very well networked. I'd also like to remind you that you can contact the Research Inquiry Service for any questions for Horizon Europe. This is accessible through the EU Funding and Tenders portal, but also via the event page for this event under the section Contact. And finally, we have Slido in operation to help you post questions. And we ask you to prepare these as early as you can so that we can prepare our answers. Please take the time to write them clearly and in the correct section for the topic. This event is being recorded, so it will also be possible to review the event further. And now I'd like to hand over to my colleague, Henriette Van Eyl.
Thank you very much, Stefan. So my name is Henriette Van Eyl. I'm the head of unit in DG Research and Innovation. And on behalf of the 4 co-chairing DGs, DG Research and Innovation, DG Santé, which is the health DG in the European Commission, DG HERA, which is about preparedness, and DG Connect, our digital DG, I'd like to thank you very much for logging on and logging in and for your interest in these calls. So as Stefan mentioned, these are ad hoc calls. And what does that mean? It means that we are doing a special effort to reach out to 3 very important target audiences. Target audiences of researchers, innovators that we felt had been under-serviced in the last 1 or 2 years. Now we've made the special effort with special deadlines, and also today is a start of informing you about these 3 topics. The first topic that you will hear about is to encourage implementation research for diseases that are happening and that are unfortunately many patients are suffering in low and middle income countries. The second topic invites the participation of procurers. Procurers could be in hospitals, in regional governments, in social services. And procurers have a very, very strong demand pool for innovations. So we'd like to encourage procurers, and that is in our second topic. And our third topic is even more special, because this is about a partnership between funding agencies and also involving research organizations to set up ever-warm clinical trials for pandemic preparedness. And this is a first ever that we're going to do this together across borders, and it's one of the lessons learned from the COVID pandemic, that we have to be prepared, and that we have to be prepared with doing clinical studies. So those three topics are now in this ad hoc call. Of course, alongside there are also the normal calls. So just to put this into context, I share with you in 1 minute about what is happening at EU level in health research. So today you are with colleagues of the health cluster. So this is cluster 1 in Horizon Europe, dedicated completely to health research. But Horizon Europe also has many other opportunities for health research. The European Research Council promotes and funds excellent researchers throughout their careers. Marie Curie is also doing this from PhD students further, and also with cooperation across borders. And the EIC, the European Innovation Council, targets companies. And about 30% of EIC money, of this SME fund money, is now going to health and biotech applications. As a third part, health research is also done in partnerships. And these are partnerships with industry, like the EHI, the Innovative Health Initiative, with African countries. This is the EDCTP. But we also have partnerships on rare diseases, on personalized medicine, and there will be a future brain research partnership. And finally, the EIT Health is an amazing opportunity to combine health digital with also regional nodes. So homing in on Cluster 1. Cluster 1 is the health research program of Horizon Europe. It has 6 destinations, going from health prevention to cure, diagnostics, a digital side, and also around informing health policymakers. Across the 6 years of Horizon Europe, or 7 years of Horizon Europe, the total budget of health research is 6 billion euro. So today we are only going to talk about a very small part of that, but the overall envelope is 6 billion. And I'm very grateful to the colleagues in the HDEA agency for managing and spending and helping us to support with that money. So I would like to end here. I would like to thank you for your interest in these 3 topics. They are new topics, they are novel topics. I'm very keen to hear from you, to hear your questions. We will try to answer these as best as we can during the next 2 hours. But I hand over to Stefan for some final words. Thank you.
Thank you, Henriette. And indeed, thank you for giving us this context and also the wider picture of the funding instruments available to people out there. And as final, before we have a short break to prepare for the topic presentations. I'd just like to remind you that the topic texts have been available for some weeks. And when considering a topic, it's really important not just to read the text of the topic, but also some of the introductory material that is in the work program that helps you with the context and helps you prepare fully and optimally a proposal. So now we'll make a short break as my colleagues will join us to present the first of the 3 topics. Thank you, and please bear with. Welcome back. We're now going to tackle the three topics. And the first of these topics is the 2024 Diseases 13-1, Implementation Research for Management of Multiple Long-Term Conditions in the Context of Non-Communicable Diseases. This topic stems from the European Commission's membership of the Global Alliance for Chronic Diseases, also known as GACD. This is an alliance of international funding agencies representing over 80% of the work's public health research funding, and the first collaboration of its kind to specifically address non-communicable diseases. The GACD supports implementation science to improve health outcomes. This topic is launched in consultation with other GACD members and aligned with the 9th GACD call. So now I would like to invite my colleague Greg Osianik from DG Research and Innovation to present.
Thank you very much, Stefan, for this nice introduction. So, good morning, everyone. So, I will briefly present you our topic on implementation research. This topic is placed in the work program 2024 under the Destination 3, which is entitled Tackling Diseases and Reducing Disease Burden. Next slide, please. So, Destination 3 addresses an urgent need for research and innovation to develop new prevention measures, public health intervention, diagnostic, vaccines, therapies, antimicrobials and alternatives, as well as improves the existing prevention strategies to create the tangible impacts taking into account sex-gender related issue. It also addresses the key strategic orientation presented in Strategic Plan of Horizon Europe, specifically the key strategic orientation related to creating a more resilient, inclusive and democratic European societies, which has the specific impact in the area related to good health, high quality accessible healthcare. So next slide, please. The expected impacts of Destination 3 includes reduced health burden of diseases in the EU and also worldwide, reduced premature mortality from non-communicable diseases, promoted mental health and well-being, strengthened research and innovation expertise, human capacities and know-how for combating communicable and non-communicable diseases, reduced cross-border health threats of epidemics and AMR pathogens in the EU and worldwide. And last but not least, it's also have impact in generating better knowledge of diseases threats that allows to be involved and to allow the citizens, patients, could you please back, to be involved and empowered to make and shape decisions for health, and also to better adhere to the knowledge-based disease management strategies and policies. Next slide, please. So the topic under Destination 3 for this Info Day is entitled Implementation Research for Management of Multiple Long-Term Conditions in the Context of Non-Communicable Diseases. And as Stefan mentioned, it's launched in consultation with the Global Alliance for Chronic Diseases. This topic is currently open. The closure date, so submission date of the proposal is on 26th of November this year. This is the research and innovation action with a total budget of 20 million euros. And the Commission estimates that something between 3 and 4 million should be sufficient to cover the expected outcomes and scopes of this topic. But of course, the applicants are free to propose the budget which corresponds to the work presented in the proposals. Also, what I would like to mention here that I will very briefly present the topics. So for all the details about the topics, requirements, please refer to the official text in the work program of 2024. So next slide, please. So, as any of our topics in the Horizon Europe Work Program, this topic has also very specific expected outcomes, which also present the specific target population. So in this case, could be the policymakers, patients, citizens, researchers, etc. So I will not go in details here, so you can find it in the text. But what are these expected outcomes? So we expect that this proposal submitted to our topics will provide the access and the use of specific guidelines to implement health intervention to improve care and overall quality of life of people with living the multiple long-term condition, including NCDs. Also, the outcomes will provide the access to improve insights and evidence on how to decrease the fragmentation of care for patients living with multiple chronic conditions. They will also improve understanding how the proposed intervention could be adopted in the low and middle income country settings, and also disadvantaged population in high income country settings, taking into account the specific social, political, economic, and cultural context. And last but not least, we expect that the outcomes will include the way that the communities, the local stakeholders, authorities are fully engaged in the implementation and taking up intervention for management of multiple long-term conditions in the context of NCDs, and also in this way contributing to better health. Next slide, please. So let's look at the scope of this topic. So this is the implementation research topic. So the requirement is to focus on implementation research for management of multiple long-term conditions in the context of NCDs. And of course, this has to be done in the low and middle income country settings or and disadvantaged population in high income country. The focus is on one or more evidence-based intervention known to promote integrated management of multiple long-term conditions. The applicants must justify the choice of the interventions and provide evidence of the intervention effectiveness, acceptability, feasibility, and potential for long-term health and other impacts. The applicants should also explore the implementation of proposed intervention for the selected study population, taking into account certain specificity like the unique social, political, economic, and cultural context in which the study will take place. What is very important is that except the patient with existing multiple long-term conditions, the study population may also include the patients with chronic infectious disease or have the mixture of both. So what has to be provided in the proposal is then an appropriate strategy for measuring implementation research outcomes and real-world effectiveness outcomes and indicators. Next slide, please. So applicants should also address the health equity and the principles of the universal health coverage. The proposal should also include the appropriate stakeholders engagement strategy. They should have also implementation research outcomes to address the multiple long-term conditions. So as there are many aspects related to the social science and humanities in this type of the research, they should assure that there is an effective contribution of this type of disciplines and expertise in the consortium. And last but not least, the granted proposal will be invited to network, to have joint activities that will be very much encouraged by the commissions. So what is also very important, and this is mentioned clearly in the text of the topic, is the list of the type of the research that will be not funded under this topic, and it includes, for example, the proposal that focus on primary prevention of NCDs or other chronic conditions, proposal with a primary aim of informing the development and or selection of an intervention for a given context, epidemiological cohorts, etiological work, mechanistic epidemiological research, unless this is really related to the implementation research approaches they can do, and also the clinical studies, validation studies, or intervention efficacy studies for new and established pharmacological agents or behavioral interventions. So this is more or less in essence the topic we will now discuss with you or answer the questions you will provide to us via Slido. So I very much encourage you to send us the questions. So we are looking forward to your participation. Thank you.
Thank you, Greg. Indeed, we have, thank you for this overview of the topic. As you said, the text is available and that should be consulted as the ultimate reference. And the idea was just to give a quick overview of what is covered. Now we have a number of questions already coming in Slido, and indeed, please send us more questions. I will read out the first question. The allocated budget is 20 million for 5 proposals. Does this imply that each proposal is allocated 4 million? Is this correct?
Thank you for this question. So I mentioned this already in my presentation. So the budget is 20 million and we provide the estimates. So it's not the fixed allocation of 4 million per proposal. So applicants are free to propose any budget which corresponds to the work they present in their proposal. So please keep in mind that this will be evaluated. And of course, this has to be, matching the reality and really the cost for the type research of you would like to conduct and present.
Thank you, Greg. This is a standard type of issue for all topics. We give an indicative budget. We give also an indication of what the Commission thinks is a reasonable estimate per topic, per project. But it is ultimately up to the applicants to decide what is appropriate and what is required to fulfill the work they have outlined. Now, the next question is quite specific. Is it appropriate to create a multifunctional intervention program for sick children that develop spiritual intelligence integrating with medical help?
So thank you very much for this question. This is very specific, and we will rather not provide you the feedback to this type of the questions to not really give the direct interaction, because at the end it's up to the evaluators to judge whether the intervention you propose is appropriate for this type of study or not. But in the call text, we give you more or less the idea of the typical research which could be conducted under this topic. Of course, what we provide in the call topic text is not the exhaustive list, so you have to provide something that really you think would convince the evaluators that the research is in the scope of the call.
Thank you, Greg. The next question is as follows. Would an intervention in lower, middle and income countries, such as North Macedonia, Serbia and Georgia, plus a comparative study in New Zealand with indigenous people be reasonable?
Thank you for this question. This is also a very specific question. So please look for the general condition of our participation, especially for the eligibility criteria, because we specify which countries are, for example, eligible for the direct funding. We leave it completely free to the applicants to select the low and middle income countries from our list. So for New Zealand, New Zealand is the associated partner in the Horizon Europe. So for the New Zealand partners, there's a direct funding from EU, also like for the most of low and middle income countries. So please free to consult the general annexes to the work program 2024.
Thank you, Greg. Next, what are the conditions for having India as a partner country? Are there specific co-funding opportunities available for India? Now, we know that in some cases, India does, Indian government authorities do select some topics of which they provide co-funding. Is this the case here?
Yes, Stefan. So India, as any third country, can participate in our calls. So it's not eligible for direct funding, but as you mentioned, there is a mechanism of co-funding provided by the Indian government. So the information can be also found through the information about the eligibility criteria in the general annexes to the work program. So in this list of co-fund provided by the third countries, Indian government has the list of specific topics for which they contribute with a co-fund. So please consult this list. As I've seen the last update of this document, this core topic was not included in the list, but of course the applicants may check regularly whether there are some updates or simply reach out to the Indian governments for more information about the possibility of co-fund.
Thank you. Next, could you please indicate what can be considered a disadvantaged population, specifically in higher income countries?
So the straightforward example is, for example, the population of indigenous people in the certain countries. So we know from the past applications of from different funding agencies that there is a lot of research on indigenous population in New Zealand, in Australia, for example, or in the United States. We have also in Europe the population of migrants in many countries. So yeah, there are different options for this type of the research in high-income countries.
Thank you. Next, medication issues and mental health is quite prominently mentioned in the topic. So a focus on this is reasonable, right?
This is right, what you mentioned. Of course, if this is mentioned in the topic text, yes, it can be also presented in the proposals. So in general, if something is not excluded, it's absolutely possible to be included in the proposal.
Okay, thank you. I'm moving on. Is there a list of non-communicable diseases which should not be considered?
No, we do not exclude any non-communicable diseases for this topic.
Okay.
But the only condition is it has to be put in the context of multiple long-term conditions.
Indeed, as stated in the title. What kind of consortium are you looking for? How many partners and countries?
So concerning the consortium, you have to look for the requirements for the eligibility criteria. So as most of our topics, there has to be at least 3 partners in different member state or associated countries, plus other partners which contribute to the proposed research. And of course, in the context of GACD topic and the specific focus on low and middle income countries and disadvantaged population in high income countries, so this has to be also reflected very well in the proposal.
And if I may add, in fact, there's no standard per topic of how many participants or how many countries should be included. It's really up to the applicants to decide what they think makes sense to achieve the project they have in mind. Of course, we have to respect the minimum requirements of EU and member states and associated country partnerships. And of course, in a topic such as this one on the with the GACD, an international component is expected. But generally, for all our topics, there is no indication of that you should have 12 partners from 10 countries. There's no minimum criteria for that would give you extra points during the evaluation. I think it's important to say that. Okay, next. Would a proposal including an innovative technology for the management of long-term non-communicable diseases be suitable for this call?
So please remember that this is the implementation research topic. So in this case, the development of the innovative technology from scratch, it's not really in the scope. So it's the implementation of evidence-proven interventions as a main scope of this topic.
Thank you. And the next question is about UK participation. Is the UK already considered a third country? Could be included as a regular partner in proposals? Well, in fact, the UK was considered as a third country for the first 3 years of the framework program, but is now an associated country. So indeed, it can be included as a regular partner in proposals, which will be funded directly through the framework program, rather than by the UK, as was the case in the first 3 years of the framework program. I hope you don't mind if I took that one.
Very good, Stefan.
But I will give this one back to you. Is it mandatory to include partners from lower income countries or middle income countries?
So this is a requirement, a specific requirement of this topic. But of course, if you include disadvantaged population in high income countries, then you are not really obliged to include the low and middle income country partners. But what is important that you include low and middle income countries and or high income countries. So we give you the choice, but definitely this has to be covered by the composition of your consortium, and also the research has to be done for this type of the population.
Thank you, Greg. And another question on participation. May it be better to focus on a specific region or subcontinent, or to include multiple continents, i.e. lower middle income countries plus vulnerable populations in developed countries?
So there is no universal answer to this question. So it's up to your research. We used to have the proposal which had, for example, countries in Africa, Southeastern Asia, and also some disadvantaged population in the European countries. So it's really up to the research you want to conduct. It's up to the applicants to really think about their research, what they want to achieve, which objective they have, and what is the impact they would like to have.
Thank you. Next, could you deepen a little on the scope of the implementation research, i.e. size and significance, compared with the limited pilot mentioned in the call?
I'm a little bit puzzled what you mean by the limited pilot, because we don't really mention a pilot. It's rather like a non-exhaustive list of the possible research plans or strategies or interventions. Yes, so in the implementation research, you have to look at the different parameters, whether this is feasible, there is acceptability for the certain intervention, for the implementation cost, etc., etc. So you have to make your research, in the spirit of the implementation research methodology.
Thanks, Greg. Next, should a single intervention be chosen for all countries in the consortium, or can different implementation strategies be considered for different interventions?
So this is up to the applicants. So we are completely open to any type of the research you present, but please remember that it has to be coherent in terms of the methodology objectives, and also has to be convincing for the evaluators, which are the specialists in the implementation research.
Thank you. Next, we have a suggestion rather than a question. May be to mention here that USA entities are specifically eligible for this call. Can you confirm?
Yes, the US entities are eligible to this call, like to any calls of work program presented in the cluster health. So there is a bilateral agreement with NIH, National Institute of Health of United States, that the partners from US can obtain the direct fundings from the Horizon Europe, and vice versa. The European partners can receive the direct funding from the NIH.
If I may add on the point of USA participants, I think it is worthwhile, if you have potential US participants in your consortium, please ask them to check with their institution if they can sign up to our grant agreements, because in some cases, some US entities are not allowed by their own laws to sign up to our grant agreements. So it's worth checking that. Another easy way to check is if the entity has been funded before by a framework program, project, and that can easily be found on Cordis, but worth checking. Next question. Can people with mental health problems in higher income countries considered per se a disadvantaged population? Can be justified? Can this be justified?
So thank you for this question. Of course, this is something which is quite difficult questions, because it depends on the justification and specification. So don't forget that you have to really present the very convincing case and justification to the evaluators that they consider this as a disadvantaged population.
And I think next we have some rather specific questions. Would a proposal focusing on endovascular treatment in minor stroke patients to diminish cognitive impairments be covered by this call?
This is very specific, and again, I will not really give you the direct answer. So please remember that what you present in your proposal will be evaluated, and this has to be in line with the scope of the proposal and convince the evaluators that this is really the research, that it's the stage of the implementation.
Thank you, Greg. Next question. The evidence of the intervention to be implemented, how robust has it to be? Can results from previous EU-funded projects be used?
So if, for example, you have the evidence which is proven already, published, you have quite strong data supporting it, we can also allow the certain level of the assessing effectiveness in your specific study population on the specific countries. So yes, we prefer to have a very strong evidence, but we can envisage that the field is developing very much, and the certain types of intervention needs maybe some adjustment or assessment of effectiveness in the specific settings, and this could be covered. But for this, only the limited time of the project can be devoted. So don't really focus your proposal of something which is in the early development stage.
Thanks, Greg. Next question. The systematic review mentioned in the call, should it be carried out during the project, or should it be described in detail in the state of the art?
It should be presented in the state of the art. So we would like to have really the very, as I say, preferably the strong evidence for the intervention that will be implemented in the low and middle income country settings, or for the disadvantaged population in high income country settings.
Thank you. Next, we have one of the earlier questions from Mr. Del Pozo coming back with a specific clarification. With the pilot, I meant this: a limited period of testing the effectiveness of an intervention adapted for local implementation is therefore usually appropriate.
I think I answered these questions just a minute ago. So yes, this is what I say, that for some intervention we can understand that the evidence, it's maybe not very, very strong and needs a certain adjustment for the specific country settings or the specific population. That's why this type of the hybrid approach, having the components of the effectiveness research plus implementation research, can be accepted in this type of the proposals.
And a follow-up question to that: what could be the weight of this part in relation with the overall project?
So this, of course, is in the hands of the evaluators of the proposals. If they consider that this is not really appropriate to be in scope of the call, or to reach the expected outcomes of the calls, this is a risk that it might be not highly ranked.
Thank you. And now a question which can probably be applied to many topics. What is the maximum duration of the proposal?
So, of course, it has to be reasonable. So it's very rare that the applicants propose 10 years. So usually we have project between 3-5 years. So, but it's really up to the applicants to look at the work plan, because this is a part of the criterion related to implementation, and of course it will be evaluated whether the time you propose for the work you present in the proposal is appropriate. Yeah.
Indeed, I think it's important to emphasize that this is applicable to almost all topics. The proposal, the duration of the project is really up to the applicants to decide what is appropriate, and this has to convince the evaluators. Sometimes we see over-ambitious timelines which can somehow discredit the proposal. So be realistic and plan well. And then we have another question. Would you see implementation of home hospital services with patient data portability and data sovereignty suitable to this call?
So this is also very specific questions, but if you look at the call text, we foresee certain type of the research which are related to the integration of different types of care. So going from the community through to the primary care, tertiary care, home care, hospices, etc. So, I mean, look at the call text, and this gives you a lot of opportunities. So we don't want to really specify and give you the clear, sharp answer to not, limit your research.
Thank you, Greg. I think that is our last question. So thank you very much for these many and diverse questions, some of which allowed us to go a little bit deeper in the topic. Others allowed us to clarify and give also some answers which are of general interest to for all topics. I think we're going to close soon if there are no more questions on this topic. And maybe I'll ask Greg if you have any final words, although we have one more question. But maybe you can think if you have any final words of conclusion when we come to our last question. But we have one more question. Hybrid study is less likely to be funded?
No, we don't give any restriction or any limitations to the type of the study. So the hybrid study could be also possible, but please keep in mind that you have to convince the evaluators that this is really in scope of the topic. So we say that for the hybrid studies, so for this part on the effectiveness, there has to be only limited time of the project proposal devoted. So don't plan your work in the way that it takes a majority of your implementation time.
Thanks, Greg. And indeed, we still have questions coming in. And please, if you have more questions, this is the time to ask them. We have a few minutes left for this topic. So while we address the last question that we currently have on screen, are applicants expected to provide a fully developed clinical research protocol for this call?
So in case there is a clinical study included in the proposed work, so for example observational studies, we provide as an annex the template with the to present the essential information about the clinical studies. So there are very specific questions which helps also the evaluators to judge about the completeness of the proposed research.
And if I may add, indeed, if you are planning to include a study in any proposal for this topic or any other topic for any of the calls of the health cluster or the cancer mission, it is vital that you fill the annex for clinical trials.
Mm-hmm. But maybe last point to this question, so please look at the exclusion criteria, so the proposal which will not be funded, and we very clearly specify in terms of, for example, clinical trials, what will be not funded, which is not in the scope of the project, of this proposal, of this call. Sorry.
Thank you, Greg. So now it appears we have no more questions from Slido. So I think I will ask Greg if you have any final words, anything you want to add before we close.
So thank you, Stefan, and thank you everyone for sending us all these questions. So maybe last word. So please read, attentively the call text. Keep in mind that this is not a regular call like a research and innovation call for the new intervention. This is more implementation research of evidence-proven interventions. The most important thing that the research has to be linked to the low and middle income country settings and disadvantaged population in high income country settings. So I wish you good luck, and I hope you will have very good experience and results in participating in our calls. Thank you very much.
Thank you, Greg. Thank you very much for your intense participation in this briefing and answering all the questions. So we will leave it there for this topic. And I also add my best wishes to applicants. And we look forward to receiving the proposals in November. And we will close now for this session. And we will resume in a few minutes with the next topic on pre-commercial procurement. Thank you. Okay. So welcome back to this special information session on the new topics that have been added to the Work Programme 2024. And now for the second topic, we have a partly new cast to present the topic CARE 14-1 on pre-commercial procurement for environmentally sustainable, climate neutral and circular health and care systems. This is a special instrument, a pre-commercial procurement. And for this topic, we have two colleagues from the European Commission's DG Research and Innovation joining us, Lieve Bos and Anapia Papageorgiou. And the presentation will be presented by both of the colleagues, starting with Lieve. Please, Lieve, go ahead.
Many thanks. So I'll start to explain you the funding instrument, what pre-commercial procurement is, how it works, and how we can support it. In other words, the rules of the game. First of all, why do we support pre-commercial procurements? Well, traditionally, our research and innovation program has been funding the supply side. So researchers, companies, we encourage them to be innovative, but we leave it often up to them to then afterwards find the customers. With the innovation procurement support, we tackle the things from the other side. We are looking here for buyers who want to look for innovative solutions. And why is it important to complement these traditional push instruments that push innovation to the market with pull instruments from the demand side? Because this can bring additional innovations and faster to the market. Sometimes companies don't see the demand for innovations and therefore they don't invest in the development of them. But if the buyers stand up and say, hey, we need innovations in this area, this can change the game. That's why we do innovation procurement, to open new business opportunities for companies and to speed up also their time to market when they can work together with the public buyers to tackle the challenges quicker. It also helps companies attract investors and create new jobs, new opportunities in high-tech areas. Of course, for the demand side, it's also interesting because it helps them to address concrete challenges that can improve the quality and efficiency of their operations and can address wider societal challenges. If we look further, what is then actually pre-commercial procurement? We all know what normal public procurement is when public buyers buy solutions that they need, but pre-commercial procurement comes before that, when there are actually no good solutions on the market yet to address the need of the public buyer, and new research and development is needed to bring them to the market. So then we use pre-commercial procurement to de-risk new technologies, new solutions, to compare different solution approaches that have not been completely validated or tested against each other yet. And it's often also used when it's too risky yet for the buyers to do a normal procurement that would commit immediately to go for a large-scale commercial deployment. This offers opportunities also to attract new smaller players to the market and to tackle supplier lock-in issues. So what does a public buyer do in a pre-commercial procurement? It buys actually research and development services from the market. So this offers them the opportunity to steer the development also to what they really need, and to collect the information about the different approaches, compare them, to make afterwards a decision about, okay, are the solutions ready to be deployed or not? So it's buying research and development services from several suppliers in parallel to compare the different approaches and their pros and cons. And it will be evaluating also the solutions whilst they are under development at the critical milestones in the process. And also another important characteristic of a pre-commercial procurement is that the risks and benefits of the R&D are shared between the buyers and the suppliers. What does it mean? In particular, the intellectual property rights will not be completely procured and owned by the public buyer, but the ownership of the intellectual property remains with the developer so that they can maximize the opportunities to commercialize their solutions. And the buyers will retain also the rights that they need to use the solutions, license them out if needed in the cases where they need it. Looking further, to visualize this a bit, you can see what the whole procurement process looks like. Before procuring, the procurers will do an open market consultation to check with the market how far ongoing developments are and to prepare their tender specifications. Once they start procuring, the pre-commercial procurement process, as you see there, is buying research and development from multiple suppliers in parallel and doing evaluations after the typical phases in research and development. This covers typically can cover all the TRLs, but it typically goes from designing the solution in a first stage, then checking which solutions still meet the requirements and only proceeding with those that still do, to the second phase of prototyping and testing the solutions in a lab setting, and finally to developing the final solutions and testing them in a representative environment of the procurer. It can also include deployment of the solutions that have been tested, but we will discuss this later in more detail. What's important to know is that pre-commercial procurements only cover this part, so research, development, testing, and possibly deployment of a limited set of solutions that were developed during the project. They don't cover wider, large-scale deployment, which typically happens in separate procurements afterwards, that we call public procurements of innovative solutions in the work program. You can check our website for more examples of public buyers that have already done pre-commercial procurements on different topics. Interesting is that a pre-commercial procurement, because it only covers this research and development phase, it doesn't fall under the normal public procurement rules. It doesn't fall under the procurement directives, European procurement directives, and doesn't fall under international public procurement agreements, which means that we can put some specific requirements in this procurement to support European strategic autonomy, meaning that the procurements can be limited where needed to companies coming from Europe and associated countries to the Horizon program. They can stimulate development and even wider commercialization of the solutions afterwards in Europe. If we continue, here is an example of a project, actually two projects. Talea, consortium of public buyers of hospitals from different countries around Europe, started first doing a pre-commercial procurement project where they developed and tested solutions to make interoperable solutions for telemedicine in intensive care units. They interestingly not only did research and development in this project, but also bought a first copy of the resulting solution as part of the pre-commercial procurement. And then afterwards, with an increased wider buyers group, started a new project, a PPI project, Procurement of Innovative Solutions, to deploy them at wider scale. What do the solutions do? They developed new big data and self-learning algorithms that predict, in fact, for the doctors in the hospitals, which patients that are in intensive care units are developing increased risk for sepsis, so that they can detect them earlier, and this reduced the mortality rate in hospitals significantly and also reduced the length of stay of the patients in hospitals. If we continue, we see more examples, and now also showing what the impact of procurements has been. Let's look at the impacts on procurers. Procurers not only benefit from deployment of the solutions, of course, that are being developed and tested, but also because they can drive the procurement with the requirements that they have. They can achieve higher interoperability of solutions. They can remove supplier lock-in. If, for example, in a certain sector, the number of suppliers is very limited, you have only 2 or 3 suppliers. With a pre-commercial procurement that starts with 5 or 6 suppliers, you enter, give the possibility to new suppliers to enter this market. And as we said, we can try to also, with these projects, increase strategic autonomy, so development and production of solutions in Europe. Some examples, the silver pre-commercial procurement, one of the very first pre-commercial procurements ever funded by the Horizon programs, actually by the previous FP7 program still. It created robotic solutions that for elderly care that help elderly people regain their muscle strength. One solution was developed in this area by Bioservo, company in Sweden, who afterwards became a supplier worldwide of famous buyers all around the world, in fact. Another example which shows also the complementarity of funding between national and EU level procurement projects. In Denmark, a pre-commercial procurement was done purely with Danish funding to develop disinfection solutions for hospitals. And then afterwards, once the project was finished during the COVID crisis, the EU helped to deploy these solutions more widely by doing procurements of innovative solutions for all hospitals in different countries around Europe. On the next slide, we see also the impacts on suppliers of pre-commercial procurement projects. This is an overview from all the projects that we have funded so far across the research and innovation programs. And what do we see there? Do they open the route to the market for new players and smaller companies? Yes, they more than double the participation of these innovative companies. They also increase their commercialization success rate. So we see that the high rate of companies, more than 80%, that make it to the end of the pre-commercial procurement through the whole testing cycle, afterwards also successfully commercialize their solutions. But also companies from the previous phases still are successful. It helps them to find additional access to finance, to increase their chances to win follow-up procurements, to help build partnerships with larger companies, and so on. And interestingly also, it helps them to grow across internationally, across borders, as they win more contracts, not only within their country, but also in other countries. Does it help to increase jobs and strategic autonomy in Europe? Yes, we have seen from previous projects that nearly all contractors, nearly all suppliers that win procurement contracts do almost all of their R&D in Europe and stay also afterwards doing lots of activities in Europe. We continue looking at the conditions now for participation. If you want to write a proposal, what do you need to be doing to be eligible? We need minimum 3 independent legal entities from 3 different countries, EU member states or associated countries, in a proposal. And because these projects focus on supporting joint procurements, we need minimum 2 of these 3 participants to be public procurers from 2 different countries, one of which an EU member state. So that's the minimum, 2 public buyers from 2 different countries. And they can be either what is called in our European procurement rules contracting authorities or contracting entities. So they can be really public authorities, but they can also be contracting entities, which are private entities but are still delivering public services, so they are also considered as public buyers in the procurement directives. Can any other buyers that are not public buyers participate in the projects? Yes, they can also be in the buyers group that implements the pre-commercial procurement together. So it can include private buyers like private hospitals, can include also non-governmental organizations or other type of organizations that want to join. Anybody can be, in fact, in a proposal as a beneficiary, except potential suppliers of solutions, because that could create a potential conflict of interest when they would be preparing and running a procurement that they would later also want to apply for. But yeah, if you're not a potential supplier for the procurement, you can still, and you're not a buyer, you can still participate in a project, for example, consultants or other type of entities that want to assist the buyers in preparing or running the procurement or in doing dissemination activities. They are welcome to participate as beneficiaries. Looking further into what are the roles of the different actors that participate in these projects? Well, we want to fund joint procurement, so we need, of course, a buyers group. Those will be the procurers that will really be launching the procurement together and financing the companies that win the procurement contracts. And as it needs to be a joint procurement, we need somebody to take the lead in this buyers group to publish the procurement. That will be the lead procurer. So in the proposal, you need to identify these beneficiaries in the proposal. They will be the buyers group, and this entity will be the lead procurer. If there are other additional beneficiaries in the project, of course, you need to also identify them. And as we said, they can help the procurers in other related activities in the project. There can also be third parties in the proposals, like in other research and innovation projects. And it is possible that they provide in-kind contributions to the procurers. For example, that they put at the disposal of the procurers resources or equipment or a testing site that is needed for the project. What about the suppliers? They will not become beneficiaries of the project, like we said. They do not enter our grant agreement, but as soon as the buyers and anybody who helps them, other beneficiaries in the project, start doing the project, they will engage with the suppliers through the preliminary market consultation that happens before the procurement. And of course, when they start launching the procurement and they reach out to the market, then they will start engaging with suppliers who can then start making offers and win procurement contracts. If we continue, we look into more detail about the eligible activities. We're talking about a procurement project. So in the proposal, we want to see, of course, what is the challenge that the procurers want to address with this procurement project. Which challenge in the healthcare field, which challenge in your specific area do you want to address? And why that challenge requires innovation, why existing solutions cannot address the challenge. And how do you want to what extent do you want to go with getting improvements? What quality and efficiency improvements are you looking for that you want to focus the project on? Once you will start preparing the proposal, you will also see that the proposal template asks you to specify which type of activities you plan to do in the preparation stage of the project before you start procuring, and which activities you will do in the execution stage of the project once you start procuring. In the preparation stage, like we said, you will be doing an open market consultation to consult the market about how far they are with developments. Is it realistic that we prepare the tender specifications in that direction or in that direction? By when? What budget will be needed to achieve all these quality and efficiency improvements? And the outcome of this whole preparation stage will be that the buyers group has finalized tender specifications and has finalized all their cooperation agreement on how they will implement the joint procurement. Once that's done, they will start executing it. So during the execution stage, you will have the procurement of the R&D services with the different stages of designing, testing, and so on. You will be validating whether the solutions perform according to the requirements for a sufficiently long duration in the project to really assess whether they have the impacts that are needed or not. And you can start afterwards also doing dissemination and exploitation type of activities. And if needed, also during the project, you can start other ancillary activities, such as contributing to standardization, to regulation. If you are developing a totally new solution and the regulation is not available for it yet on the market, you can start interacting with regulators, checking already during the preparation stage even of the project. If we would phrase the requirements of the procurement in this or that way, would that fit with the regulatory framework or not? During the procurement, once you start seeing how solutions evolve, you can interact with the regulators to inform them about, oh, we will probably need changes in regulation because these new solutions aren't regulated yet. Certification of solutions, you can also contribute to that. And what's also often interesting is training. You start developing new solutions. The people who need to work with them are not aware yet how to deal with these innovations in their working environment. So then you can include training even in the additional activities. Preparing a follow-up procurement is also an activity that can be funded in these additional activities. So if we look at the next slide, we see this more graphically, how the funding is then also divided. So since it's a project where the main aim is to fund the joint procurement, a large portion of the budget will go to the part shown there in blue, to the actual procurement cost to buy the development of new solutions and to all this testing and so on. But the green part shows all the surrounding activities that can also be funded by the project, starting with preparing the procurement, open market consultation before the procurement starts, all the activities that could take place during the procurement and even afterwards the procurement, preparing follow-up procurements, dissemination activities and so on. So during the life cycle of a project, we will have this preparation stage and then we will have a review to see if the project is ready to proceed to the next stage, the execution stage. And this will also be linked to the payments of the project. You will get in the beginning of the project a pre-financing to start the project and the preparation activities, and then after this first review, an additional pre-financing to cover also the bigger costs, the procurement costs that are coming. So you don't need to upfront finance all the costs yourself. There is pre-financing. Digging a bit deeper in all these financial costs, what do we actually reimburse? There are direct costs and indirect costs. The direct costs fund all the eligible activities at 100%. So this includes the price of the procurement, the price of the R&D services that are being procured, but also all the eligible additional activities that we discussed. And this may include in-kind contributions, and also for the procurement cost, it may include the value-added taxes if the procurers need to pay value-added taxes on their procurement. What's important also is that the main scope of the project is the procurement, so minimum 50% of all the costs that you foresee need to be spent on the procurement. Indirect costs are also foreseen. If we continue, here is an example how projects can divide those costs over the budget of a total project over the different types of costs. If you submit, for example, a proposal for a 5 million euro project, you have to spend minimum 50%, so 2.5 million on the procurement cost, and all the other 2.5 million can be spent on other activities. In the proposal, you need to describe and think already, okay, do I really need 2.5 million? Do I need more? Do I need less? And design a bit your financing around this whole procurement that needs to happen. You need to think about how many suppliers do I think I will have in each phase of the pre-commercial procurement to spread this budget over these different phases and see that your total budget makes sense and is convincing to the evaluators. Continuing, we discussed the last point, deployment options. We said that the pre-commercial procurement can also include limited deployment. So what does it mean? What are the possible deployment options if you've done a pre-commercial procurement? First option can be, I want to deploy solutions that were developed as part of the pre-commercial procurement. If you want to do that, you need to foresee, of course, the budget for that in the project proposal budget, in the pre-commercial procurement budget already, to buy a solution from minimum one supplier if the pre-commercial procurement delivers good quality working solutions. In that case, please remember that the procurement needs to remain an R&D procurement, so that any supplies that you buy during a pre-commercial procurement cannot cost more than half of the procurement cost. Otherwise, it's no longer an R&D procurement. If you don't want to do that, you don't want to buy solutions during the pre-commercial procurement, you can also buy them afterwards during a separate follow-up procurement. Then there are two scenarios. If it's exactly the same set of procurers and wants to buy only the limited set of solutions that was produced during the pre-commercial procurement, you can buy them with a simpler procedure, a negotiated procedure without publication from the suppliers that were in the pre-commercial procurement. If it's a new set of procurers, for example, an enlarged buyers group that wants to buy solutions, or you want to buy larger volumes of solutions, or solutions that were changed or adapted or improved, then you need to do a new procurement that is again openly published according to the procurement rules. In case where you have already a commitment to buy solutions during the project, you can use what we call a fast-track pre-commercial procurement, and that's shown in the picture. In that case, you don't need to use 3 phases for the pre-commercial procurement. You can do all the development and testing that is normally done in phase 2 and phase 3 in one phase together and speed up the whole process. You can also use a combination of the 2 options. You can buy a limited set of solutions already during the pre-commercial procurement and then buy a wider set of solutions afterwards, like the Thalia project did, as we showed in the example. And then all that's left for me is to show you the next slide with links where you can find further information about how the instrument works. The general annexes of the work program explain all the additional requirements for pre-commercial procurement actions. There are also guidance documents, frequently asked questions, and so on. And on the next slide, you see some interesting links in case you want to know more about how do I prepare a successful innovation procurement proposal. You can look at an earlier webinar on this. Or if you want to know more about other innovation procurement activities that the Commission is doing, you can subscribe to the newsletter.
Thank you very much, Liv, for this very thorough presentation of the procurement. It's even difficult to pronounce. So PCP in short. This is a powerful, it's complex, but it's a very powerful instrument which we're deploying increasingly. So we will encourage people to also review this presentation, which will be available online if needed. And thanking you again, Liv. I will now hand over to Anna-Pia Papageorgiou to tell us about the content of this particular PCP.
Okay, thank you, Stefan. So this topic is under Destination 4, which aims to ensure access to innovative, sustainable and high-quality healthcare. Can I have the next slide, please? Destination 4 has as a key strategic orientation creating a more resilient and inclusive and democratic European society, and there are multiple impact areas, of which one of them is climate change mitigation and adaptation. Next slide, please. The expected impacts for Destination 4 are that health and social care services and systems have improved governance mechanisms, are more effective, efficient, accessible, resilient, trusted and sustainable, both fiscally and environmentally, that healthcare providers save time and resources by integrating and applying innovative technologies, that citizens benefit from improved access to healthcare services, and health policies and systems adopt a holistic approach for the evaluation of health outcomes, value of public health interventions, the organization of healthcare, and decision-making. Next slide, please. So, under those conditions, we are proposing a pre-commercial procurement topic for environmentally sustainable and climate-neutral circular health and care systems. The call will close in November and has an indicative budget of 15 million euros. We estimate that projects or proposals will need 3 to 5 million euros to achieve the expected outcomes of this topic, but all proposals or any budget that is proposed for the matching activities could be considered for funding. Next slide, please. So the expected outcomes specifically for this topic are that public procurers in the area of health and care stimulate the competitive development of market-ready and environmentally sustainable innovative solutions. The procurers open up opportunities to bring to market innovations that are cost-efficient, safe, and proven to increase environmental sustainability, whilst at the same time improving or at least maintaining health outcomes and access to care for patients. The procurers facilitate the commercialization of environmentally sustainable, innovative solutions by successful suppliers through providing them a first customer reference for the validation and for first pilot deployment. And the policymakers, healthcare providers and professionals, as well as patients and carers, can exchange and adopt good practices, best solutions and technologies that the market can deliver to reduce carbon emissions and minimize waste and pollution stemming from healthcare provision, in line with Green Deal ambitions. Next slide, please. So we know that the healthcare sector is responsible for 4 to 5% of global total carbon emissions, contributing significantly to the European carbon footprint and to the generation of large amounts of plastics and other waste. The Declaration on Climate and Health by the COP28 calls for action and a joint vision on ensuring better health outcomes, in part through the transformation of healthcare systems to become climate resilient, low carbon, sustainable, circular and equitable. Innovative solutions can help to reduce this environmental impact through the efficient use of resources, increasing circularity and introducing greener materials, technologies and practices. Next slide, please. So we are looking for pre-commercial procurement actions that target consortia of procurers with similar needs that want to procure together and the development of innovative solutions for greening of health and care systems. We try to make this topic as open as possible, so proposals can target either direct and indirect footprint deriving from the provision and/or delivery of care, circularity, waste production and treatment, the footprint from the chain of supply in making and delivering products or services, more efficient use of resources, decreasing the overall sector footprint while still addressing the constant increasing demand for healthcare. We also would like the proposals envisage sufficient dialogue between the supply and the demand side through effectively involving the end users, such as clinical teams, patients, hospital structures, all that is needed to trial and potentially deploy the proposed solutions. Next slide, please. So as Lieve mentioned, we would like to also increase the impact of these pre-commercial procurement actions by asking them to declare their interest in purchasing at least one successful solution if meeting the requirements resulting from the PCP and indicate whether they want to procure this solution either during the normal PCP, so the normal procedure, or as a fast-track PCP. Proposals that choose to go via the normal procedure must include a deliverable in which the procurers prepare the follow-up procurement to buy any successful solution. Next slide, please. The transfer and adaptation of solutions or interventions from other sectors to their health and care settings is within scope. Proposals that are based on one specific solution and technology are also within scope. And proposals that require end-to-end solutions that need the combination of different types of innovations are also within scope. What is not in scope is proposals that target general infrastructure, energy supply, or the food and catering services within the healthcare setting. Thank you. And I think for the sake of time, we can answer the many questions.
Thank you very much, Anna-Pia. And I think we've had now a very good overview of the instrument and the particular aims of this topic. We will move on to the questions which have been coming in. Some of them came in before the presentations and I think might have been largely covered, but nevertheless, we will go through them. So, for instance, how many PCP projects do you wish to support? I think, Anna-Pia, you broached on that, but...
Well, of course, we'd want to support as many as possible, but what we want is really high-quality proposals. So, according to the indicative budget, we have 50 million. So, seeing on the ranking how many proposals we can fund with 50 million, we'll decide how many in the end we can support.
Indeed, we cannot stay ahead of time. How does the fast-track procedure work? Number of PCP phases, etc.
Yeah, maybe I can take this one. So typically pre-commercial procurements have used 3 phases in the past. The design phase, prototyping phase, and then the final development and a testing phase. The fast-track procedure will reduce these 3 phases to 2 phases by combining phase 2 and phase 3 into 1 phase. So all development and testing is done together in 1 phase. That's how we can fast-track the proposals.
Thank you, Lee. And I think the next one is also for you. Do the buyers, as public bodies, have to follow also their own national rules for procurements in the development of PCP projects?
Yes, indeed. They need to comply with all applicable public procurement rules. Typically, pre-commercial procurements do not fall under national public procurement rules. In most countries, they are also exempted from the national public procurement rules, but there are some countries who have specific rules for pre-commercial procurement, so you should check that. Who should check that? The lead procurer, because the procurement will be happening under the procurement rules of his country.
Thank you. And I think also, perhaps for you, what makes a PCP grant different from a research innovation action or an innovation grant, action grant?
Yeah, there are a number of differences. So R&I grants and innovation grants typically focus on different stages of the whole research and innovation spectrum, where the R&I actions focus on the beginning, the earlier TRLs, and the innovation actions on the later TRLs. A pre-commercial procurement action combines all of that in one proposal. It can cover all the TRLs from the beginning to the end. And the other big difference is that research and innovation actions include suppliers or researchers, the supply side in general, and they are typically even driven by them, while the pre-commercial procurement actions, they don't have the supply side as beneficiaries, they have the demand side as beneficiaries, and they will involve the supply side only once the project has started. Those are the 2 biggest differences.
I think that also partly answers the next question, which was, can suppliers be part of the consortium for the PCP topic?
No, suppliers of solutions for that the procurement is looking for, they cannot be part of the consortium. They will be engaged once the project is starting. But there can be private entities in the project. Like I said, buyers can be private entities that participate in the project, but there can also, among the additional entities in the project that help the procurers to implement the procurement project, there can also be private entities such as, for example, consultants.
So you've answered the next question, that the consultancy enterprise can indeed be a beneficiary in a PCP call. So we'll go to the next question. In addition to the funding rules of RISE in Europe, what other rules should potential applicants of the PCP be aware of?
Yeah, so there are the requirements for the topic itself in the topic description. Read them very carefully, because they will, like Anna Pia explained, tell you what exactly we are looking for in terms of the requirements for this healthcare topic. But there are also some additional requirements in this general annex of the work program that we mentioned, that explain in more detail what pre-commercial procurement projects should be doing. So it explains the preparation phase, the execution phase, but also that in your procurement should be open to all suppliers, not only in the European member states, but also in the associated countries, that it should be evaluating solutions not only based on who offers the lowest price, but also on the quality of the solutions. These kind of things are explained in the General Annex 8, so have a look at it. And then there are the national public procurement rules, as we discussed, that you should have a look at.
Thank you. And then another question on participation. Can only public procurers cooperate with private ones in the area of health and care? The question is not super clear.
Yeah, I think the question is, can only public procurers formal buyers group, or can there also be additional private or other procurers? So yes, any type of procurer can participate, but remember, we have an eligibility requirement that there need to be minimum 2 public procurers. Why? Because they are typically more conservative, slower than private procurers to adopt innovations. So we want to particularly stimulate these public procurers to adopt and engage with innovators.
Okay, and the next question. Is it possible to foresee budget in the proposal to purchase the solution in the case of fast-track PCP?
Yes, you should even foresee that budget if you want to buy the solutions as part of the pre-commercial procurement in the project. Then you need to foresee the budget, otherwise you won't be able to use the project budget to buy them.
And again, on participation, how many buyers have to be present in the proposal? How many countries?
Yeah, that's the eligibility criterion again. So minimum 2 public buyers from 2 different countries, and minimum 1 of those buyers from European member states. That's how many there have to be present, but it doesn't mean that you can only have the minimum amount of three participants in a proposal. You can, of course, always have more participants as you like.
Thank you, that's clear. And regarding budget balance between coordination and procurement budget, should it be 50-50? Is it undefined?
Yeah, there is a requirement that minimum 50% of the project budget should be allocated to the procurement. That's minimum. You can, of course, this means you can use more than 50% of the budget to fund the procurement, and so less than 50% will be used for all the other type of activities. That's also a difference with the traditional research and innovation projects, where any subcontracting procurement type of activities can be only limited consume only limited part of the project budget. Here it is the main objective of these projects that they do joint procurement, so that's why they can and they have to be even the major part of the project budget.
The next question refers to the last section of the call text. What are the EC's expectations in terms of commitment? This is about the declaration of interest. What does this mean? Who should it be from?
I guess maybe I should answer that one. I believe that paragraph refers to what we're talking about now, which is the choice to either go via a fast-track PCP or a normal PCP, but with a deliverable in the proposal whereby the procurers declare a commitment should there be a solution provided through the PCP R&D activities that meets the minimum requirement, that those buyers are prepared to procure the solution in a follow-up activity, whether it be their own or through national funding, etc.
Thank you, Anna-Pia. And does the coordinator have to be a public body?
No, it doesn't have to be, but it's a good thing if the coordinator is one of the buyers group. Often it is the lead procurer because he will be coordinating, the main bulk of the activities, the procurement in the project. He's often also the coordinator of the project, but it doesn't have to be. It can also be somebody else.
Thank you. Would a proposal including an innovative technology for the management of long-term NCDs be suitable for this call?
So the proposal would need to justify how the innovative technology actually targets the carbon footprint in the management of the long-term NCD to fall within scope. So that, I think, is the criteria of the call, that whatever the need that the procurers have defined is actually to tackle the carbon footprint of giving that care rather than the disease of interest. I hope that was clear.
Thank you, Anna-Pia. And now a question on the EC expectations in terms of commitment. Again, the last paragraph. procurement of the solution as part of the PCP, is this budget eligible?
Yes, the budget is eligible cost. So if you procure this as part of the pre-commercial procurement, it will be part of what is called in the proposal the PCP PPI procurement cost.
And along the same lines, this procurement of the solution as part of the PCP, would the market readability be also eligible?
Liva, do you?
Would the market readability?
It's not very...
It's not clear to me what is meant by the market readability.
Open market consultation?
If it refers to the open market consultation, then yes. Basically, all the costs that are within the procurement cost, or that are surrounding the procurement activity to prepare the procurement, implement it, or afterwards follow it up, all of them are eligible. So if it's one of those activities, it's eligible.
Thank you. Okay, we have a lot of questions coming in and moving on the board, so slightly challenging to track. Again, a question I think from the same person on expectations of commitment procurement of the solution as part of the PCP. Deliverables prepares follow-up procurement. Is this the tender documents? Please take the time to type your questions carefully, not rush, so that we can understand them.
Yeah.
So I think here it's about the deliverable in the case of a normal PCP with regards to any follow-up commitment. So I think that what exactly should be in that deliverable is up to the proposal to define, but I think the preparation stage of that follow-up procurement would make sense.
Yeah.
Okay.
So typically, procurers tell us that if they do two separate projects, first a PCP to develop and test solutions, and then afterwards a separate project to deploy them, a PPI action, that in the PPI actions, since we fund those with a lower funding rate, it is hard for them to fund all the preparation activities with this lower funding rate. Now, if you do this part already inside of the pre-commercial procurement project, this whole preparation of the procurement is funded at 100%, because the whole pre-commercial procurement project is funded at 100%. And it can include indeed all the activities that are needed to prepare this follow-up procurement. It could be another open market consultation, it can be preparation of the tender documents, anything you need to do to prepare this follow-up procurement. That's why it's attractive also for you to already do that during the pre-commercial procurement project.
Thank you, Liva. We're coming to the last questions because we're running out of time. Due to implementation deadline restrictions, can we implement a pilot project with a restricted number of partners in the healthcare sector?
I'm not quite sure what this would... I mean, for me, this sounds like, can we do a fast-track PCP? But so this question I would rather not...
Well, I think we're going to have to leave it at that. We are running out of time. Thank you very much for addressing this challenge of presenting this complex instrument, this wonderful opportunity for Europe to green its healthcare sector. And I'd like to also thank you for answering the question, and thank you to the audience for providing us with these many questions, which help us complete the picture and hopefully make it clear for all applicants. We're now going So welcome back for this third special topic presentation for the new topics in the 2024 work program. This time we are addressing the European Partnership for Pandemic Preparedness, and our speaker from DG Research Innovation is Katja Neubauer, who will present the topic and then strive to answer all the questions. So Katja, it's over to you.
Thank you, Stefan. So could I have the first slide, please? Yes, thank you very much. I wanted to start by giving you the background for this partnership. This partnership is really part of the response of the European Union to the COVID-19 pandemic in the area of health and health research. As you know, certainly the response of the EU in the area of health policy has really taken the form of the European Health Union, which has the objective to improve the preparedness and the response for a possible new pandemic or epidemic. And the partnership that I'm going to be presenting today is very much part of this, and it is part of the response in the area of research. It does take up the lessons learned from the COVID-19 pandemic in the area of research, where we saw on the one hand that of course vaccines were developed in record time, so big achievements, but on the other hand there was a perceived lack of preparedness of the research systems. So the research landscape was fragmented, and that had resulted in two issues. On the one hand, there was room for efficiency gains in the development of the highly needed evidence to guide policy actions when facing the emergency. And on the other hand, we saw a very high number, but relatively small and underpowered clinical trials that did then not deliver the meaningful results that were necessary. So there was more need for coordination at the EU level, and in response, the Commission, DG Research and Innovation, included the Pandemic Preparedness Partnership in the first strategic plan of Horizon Europe, and it was the last partnership to be included in the strategic plan. If I'm not mistaken, it was the 49th. So now with the next slide, I will take a big leap forward and will introduce the topic on the Pandemic Preparedness Partnership that has been introduced into the work program 24 of Horizon Europe. So this partnership, maybe to start by saying that it is a public-public partnership. So it is a partnership between the public authorities and the member states, between public bodies and the member states, and the EU level. It has taken the form of a co-fund. The form of the partnership, or the implementation type of the partnership, was when this partnership was included in the strategic plan not totally clear. So it was left open whether it would be co-programmed or co-funded. But during many discussions that we have had within the Health Programme Committee, there was a decision taken by the EU and by the member states that the partnership should take the form of a co-funded partnership. We have, in terms of what the partnership is supposed to achieve, I've tried to summarize this in the third point. It is about better coordinating pandemic preparedness research and innovation along the whole research continuum. And very importantly, it is about consolidating an EU-wide network of ever-warm clinical trials that are ready to pivot when a next epidemic or pandemic hits. And since this partnership includes this consolidation work and a lot of coordination work for this EU-wide network of ever-warm clinical trials, we have foreseen a funding rate of 50% of the eligible costs because we will have many in-house activities. The partnership is also to be implemented in two phases. So in the current work program, it is a first phase that was included with a EU contribution of 50 million euro. And there will be a second phase to come, still under Horizon Europe, in one of the forthcoming work programs with a second contribution, EU contribution of 50 million. So the opening date of the current call was the 25th of April and the closing date is the 26th of November. Next slide, please. Yes. What I want to do now is to present the topic. Of course, for any detail, you have to refer to the topic text as it is published. I can only present a summary. So what is the outcome? What is it really that we want to achieve with this partnership? Well, I said at the beginning that a very important aspect is to establish or to consolidate this network of clinical trial sites in the EU that are able to implement large-scale multi-country quality trials and that are able to smoothly transition to public health interventions in response to a public health emergency. So this is what we refer to as ever warm clinical trial sites. And on the other hand, the partnership is about enhancing collaboration and coordination, so to strengthen research on pandemic preparedness, to close research gaps and infrastructure gaps, and to improve the knowledge framework to improve the transnational research in the area of pandemic preparedness and response. But at the same time, it will be important for the partnership, so this is also one of the outcomes to be achieved, that it develops evidence-based strategies and policies for pandemic preparedness and response, and that the EU as such is strengthened as an international recognized actor for pandemic preparedness at the global level. So next slide, please. So what is it that the partnership should actually do? What is it that the partnership should promote? Well, on the one hand, it is very important that the partnership aligns or adjusts research and innovation agendas at the national and the EU level. So that is a very important objective. On the other hand, it is about being better prepared for a research response to a health emergency. And that is for the development of medical countermeasures, but also for non-pharmaceutical interventions and for public health and social measures. I already mentioned the consolidation and further development of an ever-warm EU-wide network of clinical research. And at the same time, the partnership should promote scientific evidence to inform the public health decisions to be taken in response to a public health emergency. And it should promote the use of agreed data standards to safely collect, store, link, and manage fair data so that the full potential of data is exploited. Next slide. So what is the scope of the partnership? The partnership that we are envisaging has a broad scope. It is really covering, as I said in the beginning, the whole continuum of research, so starting with basic research. So here will be very much about the acquisition of knowledge on the biology of the pathogens, on the transmission, on the interaction with humans, animals, and plants, in particular in view of emerging threats to human health. It will also encompass preclinical research to better understand the human diseases caused by the pathogens. It will also encompass clinical research to support the generation of novel solutions, such as medical countermeasures, vaccines, diagnostics, therapeutics. And it will also include the consolidation and further development of an ever-warm network of clinical trial sites. Next slide. Yes. So what the partnership also has in its scope is research on surveillance and on diagnostics to control the spread of pathogens. It also has explicitly in its scope the conduct of public health and social science and humanities research, so SSH research, for the development of non-pharmaceutical interventions. And it will consolidate and develop infrastructures, platforms, or networks that are necessary to have a fast and timely start of the research response in the case of an epidemic or pandemic. And it will also include capacity building through networking and training of researchers and the exchange of good practices. So, next slide, please. Yes, as I said before, the partnership will be implemented in two different phases. So what we have published now as a topic concerns mainly the first phase, What is it that should be covered in this first phase? Well, on the one hand, it will be about establishing and consolidating the network of clinical trial sites. So that is a challenging and important task. It will also be about supporting the prioritization of emergency trials, about supporting mechanisms to identify and rank promising compounds, and about mobilizing the EU and member state funding mechanisms. Here, in this regard, there is also a very important role that will be played by a subgroup of the HERA board that has been established. So the partnership will work very closely with this subgroup to achieve these objectives. It includes the EU network of home clinical trial sites, but it will also, in this first phase, implement joint calls for transnational research. Now, what should also be done in the first phase is that for the activities that cannot be tackled in the first phase, there should be roadmaps to be developed. And these roadmaps should then be implemented in the second phase. So the second phase of the partnership will build very much on the first phase. It will expand the first phase, and it can also include new partners. Next slide, please. So what is very important is that there is actually already a lot of work ongoing to prepare the partnership. We included in the work program 21 of Horizon Europe a topic for a coordination and support action, which has started to work in June 22. There's actually a small mistake on the slide that needs to be corrected. So we have this CSA, which is called Be Ready. And the main objective of this CSA that is coordinated by France is to prepare the partnership. We have currently 26 partners in this CSA. They come from 13 European countries and 2 associated countries, i.e. Norway and the UK, and also Switzerland has joined the consortium. It has a budget of 2 million euro. You can find more information under the link that is listed in the last bullet. And I will tell you more on what Be Ready is doing in the next slides. Yes. So Be Ready has many tasks, but the 2 major tasks of Be Ready are, on the one hand, to develop the strategic research and innovation agenda for the partnership. So this strategic research and innovation agenda will have to be endorsed by the partnership once it is set up. Now, I don't want to go too much into the details of this RIA that is under development, but it is important to understand that it will address 2 different time frames. So, on the one hand, the research that is to be conducted in inter-epidemic times, but also the research that is to be conducted during a crisis. And it is mainly articulated around preparing and understanding, preventing and anticipating, and responding and controlling. The second big task of Be Ready is to prepare the partnership proposal itself. So identify the partners, describe the governance, and prepare the actual proposal to be submitted under the call. Next slide, please. That will also be my last slide. So if you are interested in the partnership and you are now wondering how you could get involved, well, the best is that you express your interest either to us in the Commission directly or to the CSA, to the Be Ready CSA. We can then provide you any further information that you're interested in. And what you can also do is to contribute to the public consultation that will be launched on the strategic research and innovation agenda that is being developed by Be Ready. And we expect this public consultation to take place during the summer. You find more information on the website of Be Ready. So that is my presentation so far. Thanks a lot.
Thank you very much, Katja. That was very clear. And I think we also understood from your presentation that this is a particular type of topic. Co-fund partnerships involve upfront commitment from member states, and thus the consortium is largely composed of national organizations and preparations have been ongoing for this topic for some time. So if we move to the questions, we'll find actually that the first few questions all address this issue of the partnerships, which I think you partly addressed in your last slides, but nevertheless, we will go through them. So for this topic, how can I find partners or offer my organization as partners to others? And I think you will again refer to be ready.
Yes, indeed. So as I was showing on one of the last slides that I presented, we have this CSA, Be Ready, that is preparing the partnership. Now the partnership, as you saw, it has a wide scope, and we also envisage that there will be a whole series of different potential partners in it. So these partners, they can be research funding organizations, but they can also be research performing organizations, they could be public health institutes, they could be ministries. So that is really the kind of partner that you have to be thinking about. And if you are interested in finding these partners, or you want to offer an organization as a partner, the best is really that you contact us in the Commission, or that you contact Be Ready, and we will be able to help you.
And what about academic entities? Can they be partners, perhaps as affiliated entities?
Yes, so actually there are already academic entities that are part of Be Ready, of the CSA that is preparing the partnership. So of course the details have to be seen within the proposal, and of course all the criteria of Horizon Europe for these co-funded partnerships have to be met. But in principle, as I said, academic entities are already part of Be Ready and are already involved in the preparatory work for the partnership. Now, whether these partners, whether they should be beneficiaries, whether they should be affiliated entities, or whether they should be third parties, I mean, these are things that need to be determined. As I said before, we expect this to be a big partnership, and we want this partnership to be manageable. So we are looking, or the Be Ready is looking into how to achieve this. And indeed, it could be a solution that from a given member state, some organizations join as beneficiaries, but others or join as affiliated partners. So that is indeed a possibility, but that needs to be seen within the proposal and how exactly this partnership is to be set up.
Thank you, Katja. There's again a question centering on the partnerships. Since there's a lot of research in the scope, who should be a partner of this application?
Yes, I think I have already, in a certain extent, replied. So, as I said, it is a public-public partnership that is very important to retain. So we're looking at public bodies, at public authorities from the member states, be it ministry, be it national health institutes, so research funders, but also research performing organizations. So also that is possible.
And what is the eligibility criteria to be a partner? How many partners will there be for each country?
Well, this is a question that is difficult to reply to. I mean, the eligibility criteria, they are the normal criteria that can be found under the rules of Horizon Europe for the partnerships. And how many partners for each country, it is not that we have like a minimum or maximum amount of partners for each country that wants to join. But of course, on the one hand, we want to have the necessary organizations and the necessary partners in there. And they might as well come from the research world as from the health world or the health policy world. But on the other hand, we want the partnership to be manageable. So it is really there that a balance will have to be found. But there are no exact minimum and maximum numbers in terms of partners for each country.
Thank you, Katja. I don't see any more questions on our Slido screen. So I think we're going to conclude. Katja, I don't know if there's any last words or message you'd like to repeat at this point before we close.
Well, maybe to say that, as you know, the call for this partnership is still open until end of November, and we want this partnership to be as inclusive as possible. So we really would like a maximum of member states to join this partnership, be it more for the transnational calls, so for the more classical research calls, or be it for the establishment and the consolidation of the clinical trial sites network. So I would really encourage, in particular, the member states that are not part of Be Ready to look into this partnership and to consider whether they would like to join the consortium.
Thank you, Katja. That's a clear message. I will now close by thanking you, Katja, for your presentation. I would like to thank indeed all the speakers who prepared these presentations, delivered them and answered the questions as best they could live. I would also like to thank you, the audience, for being there and for giving us interesting questions to address. And finally, I'd like to thank the whole technical team for making this possible. Thank you. And goodbye for this special session.